Okay, we do now have some time for some questions and answers. So I'd just like to, we do have a mic. We are recording the session, so we'll make sure that we do get any of your questions on microphone. So has anyone got any questions for the panel? Yes.
Val Brody, I'm a speaker for the Cancer Council, and I often get asked about the skin cancer clinics that bulk bill everywhere. Pip, how much is your data affected by the skin cancer clinics that have appeared everywhere lately?
That's right.
Well, I think suffice to say that I'm just thinking about how I can word this, that you know there is obviously an increasing incidence, but the good thing is that increasing incidence is actually an in situ melanoma in that early invasive lesions, and there's been a lot of controversy, I guess, out there about skin cancer clinics and are they better than anybody else? But some work that we did back in, I think we published about 2007, 2008 or so, showed that basically doctors in Queensland are really good at diagnosing skin cancer, whether they're from skin cancer clinics or they're your GP. So I think suffice to say that that the most important thing is that you get along to the GP or whoever if you have anything that is actually sort of suspicious on your skin or you're concerned about. So I don't think the actual number of skin cancer clinics has had an extraordinary, over and above what we might already see, increase in incidence. What we would see otherwise is, I think, around about 2003 or 4 or so, then we started seeing a lot more skin cancer clinics, and there wasn't that sort of that huge rise at that point in time. It's been a more incremental sort of rise over time.
Don't think I'll go down the side.
Hi, my name's Joanne. I'm a radiation therapist at the PA hospital. I've also had a melanoma removed about 18 months ago. I've got a question for Pip. You mentioned towards the end of your talk about the genetic mutations. Do you suggest that people who've been diagnosed with melanoma have a test to see if they have those mutations, or to see if they do have an increased chance later on of a second melanoma?
The current recommendation is that people should not be routinely tested if they've had a diagnosis of melanoma. It's not a straightforward process to go through having the genetic testing, and there's a couple of reasons for saying that. First of all, you'd want to elicit a family history. So the genes that have been identified as conferring an increased risk are those that occur amongst people who have a very strong family history. So in Queensland, we usually say 3 or more close family members affected. Because melanoma is common, it's not unusual for people to have another member of their family, but it doesn't mean it's genetic. It just means that it's common in Queensland because we live in such a sunny environment. The other thing also is that a negative test, so someone who comes from one of those families where there's lots of melanoma in the family, only about 50% of those families have they found the mutations that are thought to underlie their melanoma. So it can be quite misleading as well, having a negative test. It's not like the BRCA1, BRCA2 for breast cancer. So at this point in time, it's not standard of care to offer genetic testing, and really it's more about vigilance, surveillance and primary prevention. But having an awareness as well that there could be some underlying genetic predisposition, but it's hard to quantify.
My name's Ken Wright. I'm from the Sunshine Coast, and I'm a member of Melanoma Patients Association, Australia, I know. Having had 4 melanomas. One of them, in fact, went on to a 3rd stage in the lymph glands. But I'm fine at the moment, which is great. I'm also doing a lot of work with the Cancer Council in terms of being a volunteer with them in a number of different programs they've got. Now, what we're finding, and I don't know who can answer this best, is that men generally don't want to admit they have a problem. If they do have a melanoma, they won't talk to their mates about it, they won't ask for help about it, and they don't want to do anything about it. Now, this would progress to the fact that they probably don't go to the doctor early enough, and when they do, it's too late. And we're seeing that in the MPA. I'm seeing it with Cancer Connect, where I've been working for 3 years with them. We haven't had one melanoma patient, male, come to the Cancer Council and ask for can they talk to someone about it. Now, I don't know what the answer to that is, but males generally have a problem, and I think needs to be worked on to see if we can get around that some way or other.
Indeed, they do have a problem. It's interesting. One of the studies that which I really do think highlights this that we did quite a while ago was looking at how patients came to be diagnosed, and we know that around about 40 to 50% or so of patients actually pick up their own melanoma. About another 20 or so, 25%. Is picked up by their partner. Now, as you might suspect, if it's a female, then she's much less likely to have had her melanoma picked up by her partner, and the opposite is true. If you're a male patient, you're much more likely to have your lesion picked up by your partner. So I agree. There needs to be a significant sort of focus on men, and it's not only for melanoma; it's other health conditions as well. I think it's well. There's a lot of men in this room, I think, who might be in that age group. So maybe we should have a bit of a focus group after this and try and work out what we can do. One of the things that we have done more recently, and I gave a talk on that just a short time ago this morning, was that we actually developed a DVD that we sent out to men over the age of 50. We just had a random selection of men, and on that DVD we had Ian Healy as a narrator. So we tried to sort of have a sort of a high profile sort of person in that in that age group. Mark Smithers, who will be talking, of course, later on, and Mark's well known to you all, was talking about the issues that men face. Who are at risk of being diagnosed with melanoma, and we were lucky enough to work on this DVD with Melanoma Patients Australia, where we had a couple of men who'd been diagnosed, and indeed one mother who had lost her son to melanoma. And what we found in that trial was that it certainly seemed to raise awareness for men to actually check their skin, and it certainly, importantly, the next step, it actually encouraged them to go along to the doctor for to actually have a clinical skin examination, because we're not asking patients or people out there to diagnose melanoma on their skin. What we're asking them to do is just raise that awareness and say, hey, look, this looks a bit weird to me. This is something new. This is something different, or this is something changing. I need to get along to the doctor to diagnose it, and that's the doctor's job to take it there. So we did find an effect with that, and we're looking now at what we next do with that tool, and whether in fact there's other avenues that we can think about using, whether it's some form of everybody in here, most people have probably got sort of smartphones and things like that. Get SMS sort of texts from all sorts of people. Whether we can do that, remind you, get along to the doctor. Have you had your skin checked? So this is an evolving area, and one area that we're very keen to progress work in.
Hi, thanks. My name's Wendy Herman, and my question is, we keep talking about screening and prevention. So what is the recommendation for how frequently people should go and be screened? And in my experience, because I had a melanoma a couple of years ago, and it was like just popped up really quickly out of nowhere. So whether it had been there for a while or whether the change had just suddenly happened in a matter of weeks. So I guess how frequently screening, is that a common thing for things to pop up? And also I reflect on a work colleague of mine, her young daughter and her family is incredibly fair, Queensland family, and her daughter had a melanoma removed off her back at age 15. And are there particular recommendations for people who have already had either BCCs or melanomas in terms of extra vigilance or protection that could be beneficial?
You're on a roll, Pip.
I need this. Do I need this? Maybe I do. I don't know. Anyway. Yes. So I guess there's a couple of things in those questions and comments that we do know. Firstly, that there are some melanomas that are very aggressive, and they do occur very rapidly. And that so again, it's sort of that vigilance for anything that sort of that is odd or whatever. In relation to the frequency of screening, there aren't any strict recommendations for how frequently you do that. But our recommendations really are that checking your skin on sort of about a 3-monthly or so basis. Now that's sort of if you're at higher risk, then you're going to be checking your skin a little bit more often. Okay, if you're at lower risk, then perhaps you're not checking it quite as often. I think in things like in the mornings when you're getting up, the first thing you see is usually if you're brushing your teeth or whatever, you're looking at your face and things like that. So they're the easy areas to sort of check. But it's trying to get people to check check their back or get somebody to help them check their back for particularly for